Hey mamas and dads, Nurse Lana here from nurselana.com. Today we're going to talk about a simple step-by-step guide to know if your baby needs to go to the hospital. You may have just had your baby and brought it home, and the truth is we're surrounded by viruses, bacteria, germs, and no matter how careful we are, our little ones are bound to get sick. It can be really scary, especially since babies can't talk yet and tell us what's wrong or tell us how they're feeling. So how sick is too sick? When do I call the doctor? When do I go straight to the hospital? Don't worry, you're not alone. These are common questions that parents ask every day. First of all, I would like to clarify that you should always call your pediatrician or your baby doctor anytime you have any concerns about your baby. Most pediatric clinics have a nurse dedicated to answering questions and to help guide you as to what the next steps might be that you need to take good care of your baby. That being said, let's dive right in and keep it simple. What are some common signs that may show you that your baby is sick? Fussiness. Baby won't calm down no matter what you do. It's crying more than usual. Stuffy or runny nose. Difficulty breathing. Fever of 100.4 Fahrenheit or higher. Lethargy or low energy. Rubbing or pulling at their ears. Rash on their skin. Your baby could be experiencing one or multiple of these symptoms. So what does it mean? Let's break it down. One possibility could be teething. Teething can cause fussiness, runny nose, rubbing and pulling of the ear, even fever. You can get your clean finger and gently rub the gum of your baby. Does your baby bite down when you get to a certain spot? Do you feel little bumps starting to come up? Is your baby drooling a lot? If the answer is yes to these questions, your baby is probably teething. For more help about teething and what to do, you can check my blog at nurselana.com entitled 7 Simple Ways to Soothe Your Teething Baby and Your Nerves. Second possibility is the common cold. It causes stuffy nose, fever, fussiness. Does your baby have a stuffy nose but is playing, smiling, eating, drinking? The answer is yes. This may just be a simple cold. If not, you may want to call your pediatrician, especially if there are some other symptoms along with it. Also, if the symptoms have lasted more than 7 to 10 days, or if your baby hasn't been drinking as much as usual, or not peeing as much. Remember, we all need to stay well hydrated. I'll leave a link for my other video that I talk about how to know that your baby is drinking enough and peeing enough. Third reason your baby could be fussy or not acting quite right could be a growth spurt. Babies can be very fussy and cranky when they're having a growth spurt. They may want to take more naps than usual, and they'll be wanting to feed more often. Babies grow a lot on the first 2 years of life, and all that growing can be exhausting. It can cause bone pain. It can make your little one very hungry and cranky. Fourth possibility is a benign rash. Is the rash that you're noticing on your baby made up of small red spots that come and go? Maybe there's a little bit on the face, then it goes away and shows up a little bit on the chest, then that goes away and shows up a little bit on the leg. That could just be your baby getting used to the environment. Baby skins are pretty sensitive, and there's a lot that it has to get used to, from different textures to different dander, maybe from dogs, cats, other pets, your laundry detergent. You can talk to your doctor about what might be irritating your baby's skin. These rashes that come and go and are moving around are usually not something you need to worry about. Now, if there is a rash that is staying in place and growing, getting bigger and spreading, you definitely want to call your pediatrician right away. All this being said, definitely call your pediatrician right away if your baby is having any difficulty breathing. And that could be nasal flaring. That could be just breathing faster than usual. Or if you look at their rib cages, you can see that rib cages show up every time they take a breath, showing they're retracting. Fast breathing, by the way, is more than 60 breaths per minute for babies less than 1 year of age, and more than 30 breaths per minute for kids ages 1 through 5. Also be worried if they're breathing slower than usual. That would be less than 30 breaths every minute for babies 1 and younger, and less than 25 breaths per minute for kids ages 1 through 5 years. The fifth and final possibility is lethargy. It's being tired, weak, sleeping all the time. Muscles are more relaxed, not nice and flexed like babies usually have them. Maybe baby's having difficulty waking up or staying awake for a little while, not wanting to eat or too weak to eat. not complaining during activities where they usually would complain or cry, like having their diaper changed or changing their clothes or being bathed. If your baby is showing signs of lethargy, call your doctor right away. Hopefully now you have a better idea of whether or not your baby's symptoms are a sign of something serious or not. Still unsure of what to do or who to contact? Make sure to check out my video and or blog post at nurselana.com entitled, How Do I Know If I Need Medical Help and Where to Go? Make sure to like and subscribe. Nurse Lana sending love to all you mamas.